Welcome to another episode of What Brings You In Today.
I'm Erica Bennett.
And I'm Taylor Fisher.
We want to thank everyone for tuning in. If you haven't already, please subscribe to our podcast and leave us a review so that you can stay connected with all of our episodes.
And if you have any questions or topics you would like us to talk about, you can submit those at sgmc.org/podcast.
And today we are here with Laura Guadiana Sanchez, MD, family medicine physician. So Dr. Guadiana Sanchez, what brings you in today?
I'm going to talk about obesity medicine.
Awesome. A big topic, something that's really gained a lot of interest in the past couple of years, I guess the past year, really. Well, before we talk about obesity medicine, let's just get a little bit about your background.
Yeah, so I'm originally from California, and everybody asked me, like, California, what are you doing in Georgia? But my husband was stationed at Moody, and so I got here because of that. But I was born and raised in Los Angeles.
Okay.
And I always had this thing about being, I was going to be a doctor. Since I was little, I always said I was going to be a doctor. And so I was really focused. I like school. Like, since I was little, I liked school. So I was one of those, like, weird kids, like nerdy kids. But I was super focused. I would, did pre-med in undergrad, and then I did medical school in California at UC Davis. I thought I was going to be a pediatrician. I actually thought, like, that was my interest, that I wanted to, like, help kids. And I had this call to service, like, I wanted to help people, and I really like kids. So I thought, I'm going to be a pediatrician. But pretty much like that first week of medical school, so they let you, you can go to, like, the student-run free clinics and volunteer. Like, it's like your first day of medical school, and you can go volunteer. And so I knew nothing about medicine. I didn't even know how to put, like, my stethoscope on, and I was there volunteering. And it was like, since then I was like, you know what, I want to do family medicine. This is really, really cool.
Well, you get a little bit of both worlds with family medicine, right? With the pediatricians. Pediatrics. Excuse me. Oh my God, I can't talk. Okay, go ahead.
No, yeah,
I'm okay. I might need medical evaluation, but you're here, so let's keep on.
I like it because you can see, like, what we call a cradle to the grave, right? You can see kids, you can see adults, you can see people in older age, pregnant women. So I love that. Like, I didn't know what I was going to see next. And you have to know a lot about a lot. Like, some people say, like, you need to know a little bit about a lot, but really you need to know a lot about a lot.
Yeah.
So, some people have a lot of, really complicated chronic diseases, and you're helping them navigate that in, like, the healthcare system, which can be really hard to navigate when you don't know exactly what's going on. Why am I on all these medications? And I love being, like, that family doctor who can, like, sit down with people and, like, explain things to them and, like, just be an advocate for their health.
Yeah, I think that's what we try to instill in all of our episodes, is the importance of having a primary care provider for that reason, to have that advocate and that person you can go to with your questions that's going to be there to support you and help you get through your health journey.
Definitely. So you're a family medicine physician. See, now Erica's disease is wearing off on me.
It's contagious.
But you had an interest in obesity medicine. So can you tell us about how that got started and everything?
Yeah, so, we didn't really get a lot of training in nutrition or weight management even when I was in medical school or in residency, really. Obesity as, like, a disease wasn't called a disease until, I think, 2013. So it was actually pretty recent. Before, it was kind of like, something like almost like a symptom, right? Like, they're vital signs. It's like your weight. But we realized that obesity is actually super complex. It's not just about calories in and calories out, right? Because if that was the case, then nobody would have a problem with it. So I didn't have that much training, but when I came here, a lot of people would, like, ask me about their weight, or, what can I do about my weight? And all I had to offer them was, like, well, eat less and move more, which is, like, not really helpful, right? Because that's what they've been doing this whole time. Or trying to. And we did have some medications, not as effective, and, we'll talk a little bit more about it, but, like, Ozempic and all of these. But there were some drugs that had come out for the treatment of diabetes that, people started to find out that actually was helping weight also. So when I started seeing these medications come out, so the first FDA approved medication that was like an injectable and was really like changing the way that we treated obesity was, I think, I want to say like maybe 2014 or 2015. But it was hard to like get. You couldn't really have insurances covering it. It wasn't really something like people talked about. So I started doing more like training in it. I started taking more classes and going to conferences, and just to have more tools to help my patients. And there is a Obesity Medicine Association. There's an American Board of Obesity Medicine. So if you do this extra training and there's certain stipulations you have to abide by, and then you take a really, really difficult test, and then you can become board certified in obesity medicine. So I decided to do that just to help my patients and have better tools to help them.
Because we probably have a high prevalence of obesity here in South Georgia.
Well,
I'm imagining.
Even just
Everywhere?
everywhere. I mean, in the United States, it's like 40% of people
Wow.
have a problem with overweight or obesity. And people who are board certified in obesity medicine, doctors, that is about like 8,000 doctors in the whole United States. So that's like 1% of doctors. So it's really something that's important. That's why it's coming to the forefront. There's these new medications that are really changing the way that we treat obesity. And I think they've been super, super helpful if you use them in the right way.
Right. Well, let's talk about, before we get into the medications, like what does being overweight or not, at your prime weight, what impact does that have on your overall health? I mean, imagine
It's
it
huge.
causes, it's an indicator of so many.
It's huge,
different
right?
things.
Yeah. So a lot of times we see people with obesity have higher likelihood of having heart disease, diabetes. Actually, certain cancers are high. You have higher likelihood when you have overweight or obesity. So it's super important. And that's why, family medicine, it's a lot about prevention, right? So that's kind of also what led me to like look into obesity more, because if I help somebody with their weight and prevent them from having a heart attack or developing diabetes, I mean, that's huge, right? They're going to be so much healthier and feel so much better. And there's this huge stigma, right, with weight, because it feels like, well, one, you can see it. You can walk around with like a thyroid problem and nobody knows what what your medical issue is.
Yeah.
But there's a big stigma, and like,
Never thought about that, but yeah.
yeah, when you can see it. And people deal with a lot of anxiety and depression because of their weight, because it's hard to treat.
I know the mental toll that takes on people, that, I mean, especially if they feel like they're trying to do whatever, but they're just never successful. And then having to always feel like you can't do it, like you're hopeless. And how do you battle that? So it's very interesting that this is like coming about now. I feel like it's definitely time in our world that we take a look at this and see what we can do. So
I think so too, for sure. I mean, there's like a lot of factors I think that probably go into being obese or overweight, and it's not all the stigma of someone that can't just control their eating.
Right.
There's a lot of other factors. There could be family factors, history, and then also like things that have happened to them, trauma,
Right.
and different things like that.
Yeah, so that's why obesity like now is designated as a disease, right? It's chronic. Like this is something that is like ongoing. Some people can struggle with weight problems since they're very young. Some people maybe struggle later, maybe because they started on a medication that they needed that might have caused them to gain weight. But now they're at like this higher weight, and it's really hard for them to lose weight. So there's environmental, component, because you might not have access to fruits and vegetables. You might not have access to those things, or that's what you grew up with. You're not really sure what you're supposed to eat, what's healthy, what's not. There's a genetic factor, of course. Just having a mother or father who have problems with weight, overweight or obesity, gives the child a 50 to 80% likelihood of having problems with weight, despite eating the same or exercise, all the other same things that somebody else who doesn't have a family history of obesity, it increases their risk of having obesity later in life.
I know I had met a woman one time that she had experienced that, which you said was when I owned a fitness studio, and she was very like hard on herself because she had been on a medication that caused her to gain like 50 pounds. And I just remember the feeling of despair, like that, you know, she just wasn't herself anymore, and she didn't feel like it. And she felt, I mean, and it was so sad. I mean, it's so sad to see that, and that people are living that every day and just suffering in silence or whatever, because it's not something you talk about really openly unless you're successful at losing weight. Then you want to share it with the world, you know.
Oh, and that's like a super, super small amount, right? And I'm not saying that you cannot lose weight with diet and exercise alone. Like that is obviously it's huge for your like your overall health. But when you struggle with problems with weight, it's way more complex than that. So we have to take into consideration those things, because there's like, society is telling you have to look a certain way, which doesn't necessarily equate to health either, right?
Right.
And you have like that thing of like, it's me, because I'm eating too much or because I'm not exercising enough. So you have like, you're kind of blaming yourself. You kind of feel like society is blaming you. So it's really hard. It's really hard to navigate. And so that's why I feel like, now that I have these tools to help people, it really has kind of changed, one, how I approach a patient and how like I try to help them, and also how they see themselves.
How do you approach it with a patient? Like what's the I know you can't tell us all you've learned thus far because it's way vast, but I guess the most helpful things that the general public or population should be aware of that now exist in this field.
So, well, one, I think the medications have really been game changers, because now we have a treatment for it. It's not a cure, right? Like this is a chronic disease like any other, but it is a treatment that has been much more effective than some of like the older medications that we used to have. So, a lot of times patients will bring it up to me. They want to talk about their weight. Sometimes that, we do kind of bring it up in a way like, hey, do you want to talk about it? Like, your weight, whenever you go to the doctor and you have your blood pressure checked, you also have your weight checked, right? So it's another vital sign. So sometimes like, if I'm going through their medications and their vitals and I'm looking at their blood pressure, I might bring it up like, do you want to talk about it? And a lot of times people are open to it. And, we can go into, maybe there was a medication, or maybe you're going through perimenopause, or maybe something happened where you can't exercise like you used to. So you really have to take like an approach, like every person is different and they're going to have different reasons for why they may have a problem with weight. It might be genetic, it might be, their environment, it might be a whole load of things, but you have to kind of tease through those things and kind of figure out what this person needs.
So what are some of the medication options that are available now that you're seeing help patients?
So we do have like the older medications, right, which are still actually pretty effective if used correctly. What I had seen before, so we have like Adipex or phentermine, which is a super old drug. It actually came out like in the late 50s, early 60s. So it's been around forever.
Yeah, I feel like I've heard that Adipex word several times.
Yeah, a lot of people have tried that medication. It's a stimulant. And so it works on like your central nervous system, and basically it does help with your hunger. It helps cut your hunger. It's kind of like in the realm of like kind of ADHD type of medications, so like some people who are on ADHD medications, which are also stimulants, often like they're not hungry.
Right.
So things like Adipex can be helpful. There's another medication that's also oral. We don't talk a lot about these because, the sensationalizes like Ozempic.
Yeah.
But these other medications have been around for a while and are also quite safe. So there's another medication called Quizimia that has phentermine, which is that, old drug, which is a stimulant. And they paired it with another medication called topiramate. And topiramate is a medication we use for like seizure disorder, we use for chronic headaches, we use for a bunch of other things. But when they put them together, they actually worked synergistically to help people's weight. Like the Topamax kind of helps with cravings. It also makes food taste funny. So people
So
like
you're not as hungry. You're like, I don't enjoy it as much,
right,
you know?
because it tastes a little weird. Or like carbonated drinks sometimes like will taste flat. So you're not gonna have like, especially people who like drink a lot of soda.
Yeah.
They're like, I can't have my regular soda. So which helps, right? If you're not drinking the sugary drinks. So Quizimia came out. I'm not sure when that one came out, but that one's been out for a little while too, and also helps people with weight loss, something like 10 to 12% of their body weight on average. And then you have like these new drugs, right, which are the GLP-1 receptor agonists. That's like Ozempic or Mounjaro. And now they came out with like the FDA approved for obesity, which is Wegovy and Zepbound. But actually, like back in, I think the first one that was injectable, FDA approved, came out, I think in like 2015. That one was like a once a day injection. And it's in the same class as like Ozempic and all of those. It does help with weight loss. It's like not as much as like Ozempic and these new ones. But that was like the first drug that really changed how you could treat obesity. So GLP-1 receptor agonists, the way that they work is we have a bunch of GLP-1 receptors in the body, right? In our brain, in our stomach, because that's where they mainly work for weight loss, in our pancreas, in our heart, in our kidneys, everywhere. So the medications go in, they stimulate those receptors, and like in the brain will help you feel full faster. In the stomach, it delays gastric emptying, so food stays in your stomach longer, so then you stay full longer. So it works a little different, obviously, than like a stimulant or this other one that helps cravings. And they've been really effective. You know, so people have lost anywhere between 15 to 20% of their body weight, which is a lot, right?
Yeah.
It's a lot. It's like you're going towards like bariatric surgery type weight loss.
Yeah.
And that's like the majority of people. Some people might lose less, some people might lose more, but like on average.
It's so interesting that you can change your weight basically by changing how your brain perceives different things.
So, right. Well, this is why, we're studying obesity more and like how it works, because it really is affected by the hormones in our body that tell us when we're hungry, when we're full. Whenever you eat something, you have hormones that are released that tell you like, okay, you're about to get full. Or when you're hungry, right? There's something in your body. Your brain is controlling that. Your brain is controlling when you're hungry to keep you alive, obviously, because you need energy. That's what food is. But with people that have problems with obesity and overweight, those hormones, they're just not functioning correctly. So if you have something that's helping those hormones work better, then you'll see the loss.
Because I feel like in the past, I've always heard like to get your hormones checked or even your thyroid levels or different things that could, other things outside of that I feel like people are like go to when they were trying to lose, thinking that they're gaining weight unnecessarily or something. But
so these are not hormones we can really like test for necessarily. Like there's not really good tests that say like, oh, you're not making enough leptin, which is like the hormone that tells you you're full. Or a lot of times people, they ask for like, can you check my hormones? Like women especially, right?
Right.
Which hormones can play a role. You'll see a lot of women will come to me like when they're in that almost menopause or menopause, because things have changed and like even our bodies change, right? We start losing muscle.
Right.
Even after the age of 30, we start losing muscle. So that's going to change like the way our metabolism works. So it doesn't really help all that much, I can tell you.
Yeah.
Other than like we know you're in menopause.
Yeah, I've not really heard it ever be successful. I just remember I've heard several people like say that. So
yeah, so
like, in the past.
But like some hormones, like the thyroid hormone, can affect. Like some people can have some weight gain, like if their thyroid is not functioning fast enough, if you're not making enough thyroid hormone. So that can also affect. So thyroid hormone is something that I will check when someone is like worried about their weight or they're having some weight gain or they're losing too much weight, which is another problem too.
So how do you determine out of those medicines, like what will work best for the patient? Is it kind of like a trial and error kind of thing?
So the first thing I want to say, like, about medications, because, sometimes people will come and they're like, I want this.
Yeah, give me this. Like,
but it doesn't necessarily
sometimes,
mean,
I'm sure a lot of times.
so
They've done their research at home. They already know the cure.
right.
Tell me give me this.
But whenever I talk to people about medication, the first thing I tell them, it's like, okay, this medication is kind of like like you can kind of think about it like with blood pressure, right? A blood pressure medication. It's going to help control your blood pressure, but if you stop taking the medication, your blood pressure is going to go up. And that's very similar to weight loss medications. So there's a few things that I have to take into account. One is the cost, right? Some people are probably good candidates for the injectables, Wegovy and Zepbound, which are FDA approved, but their insurance might not cover it. It might be super expensive. And so, the other medications that are oral medications might be a little bit more affordable. So sometimes it really boils down to like the expense. And the other medications can be good in the right patient. That might be what they need. Some people do not like needles. Some people do not want to inject themselves, and they might just want an oral medication. And again, I talk to them about, like, this is a treatment. It's a tool. It's still
Not
hard
the end
work.
all. Yeah, like you still,
It's still super hard work. You still have to change your eating habits. You still have to, like, focus on your overall health. And I would say, like, the majority of people do come and ask about weight loss because they're worried about their health, because their parent died of heart disease, because they have a strong family history of diabetes, they don't want to get diabetes. I would say, like, the majority of people are focused on their health. And so, whenever we talk about medications, we're focused on, like, okay, let's see what, if you're a good candidate for this medication, or maybe we can try the oral for a little bit. It just kind of depends.
So you mentioned that, it still is work having to take medication and adjust to a new lifestyle. Medications change how you feel and stuff. Same thing with, like, bariatric surgery. I mean, because that's a big deal too. You have to go through several evaluations beforehand, work with dietitians, and then you have the surgery, and then you have to basically adapt a new lifestyle with eating, which is also hard and requires effort.
Yeah, no, definitely. And so you do see a lot of people, like, regain weight after bariatric, not immediately.
Right.
Of course, you, like, lose weight immediately, but over time, if you haven't made, like, the changes to your lifestyle, a lot of those, like, habits start coming back. And that's when you start seeing some of that weight regain. So that's why whenever I talk about medications, we're like, okay, this is a tool. We also have to focus on your nutrition, on physical activity, which physical activity I don't pair to weight loss itself, but more for, like, your overall health. And, how much are you sleeping? Like, are you, like, your stress level? Like, you take all of those things into account, because those things are the things that are going to also affect your weight. They're going to affect, like, how much you can lose, or when you have, like, times when you can stall out. So all of those things are factors.
What is it about stress that makes you want to eat? Have you learned that? Have they figured that out? I definitely feel like I, like, want to stress eat sometimes.
So
when I'm stressed, I'm like, and especially want to eat, like, unhealthy stuff.
Right. So, I mean, I get that from a lot of people, because we eat for a lot of different reasons, not just because we're hungry, right? Like, when you're stressed, sometimes it feels good.
It's just comfort. It just brings you, like, a comfort level.
There is a part of your brain, right, like, where you felt good having ice cream, and, like, so when you're feeling down, like, having a bowl of ice cream kind of fills something else for you. So yeah, we eat for a lot of different things. We don't always eat when we're hungry. Again, this is why obesity is so hard to treat, because it's not just calories in, calories out. It's not just like, I'm just going to eat less and I'm just going to exercise more, and that's it. Because then everybody would do it.
Or it's using food as a reward, which I feel like is something that we're taught a lot as kids by our parents.
Right.
Is
if
that
you're good, I'll give you a treat.
So now I'm like, oh, well, I adulted all day today, so I deserve a little treat.
Yes. Or you need to clean your plate another end of what we're taught as a child. Eat all your food. Don't leave anything behind.
Which now I rarely clean my plate because I just don't eat. I'm one of those people that are on the ADHD medicine that don't eat as much as I used to, which I feel like I've realized I was probably eating more than I should have anyway. Because now I feel fine. I'm not falling
You're
over
not
because I'm
yourself,
not.
right?
I'm not cleaning my plate, but I'm still getting enough nutrients. I'm trying to get as much protein as I need.
I think it all just goes back to figuring out, what lifestyle is maintainable for you, and then to help you with whatever genetics, with whatever you've conditioned yourself, or, you have been conditioned to believe in your brain is how it's operating. And
the medications aren't magic. Like if you're taking, some people will find a way to get them somehow online, and you might lose weight for a little bit of time, right? Because sometimes when you are using it in maybe not the correct way, you just maybe are not eating, and you're not getting the nutrients that you need, which is also not good for your body, right? Your body needs fuel. Your body needs energy.
And I feel like I have heard that there has been a rise of people coming to the hospital because they are malnourished, because they are using those type of drugs, and then it causes other issues if they're not making sure that they're getting what their body needs to sustain itself.
That and some of these medications, like these injectable medications, one of the main side effects is going to be nausea and constipation. And the nausea can be really bad. I mean, where people are, physically ill. Yeah. A lot of times that has to do because they're going up on the medication way too fast. They just want to lose weight. Just give me the medication so I'm not hungry and I can just lose the weight. But, you have to weigh your risks and benefits to everything you take. And the nausea and the GI upset can be even reasons that people can't take the medication. Sometimes people just don't even tolerate it. The reason that you get nauseous is because, how I mentioned, those GLP-1 receptors that are in the gut, they slow down the gut, right? So food is staying in your stomach longer. So if you eat too much, you can feel sick, or and so you'll have also a lot of GERD symptoms. I mean, you can have really bad side effects also, or end up in the hospital with really bad constipation. Constipation can hurt. I mean, it could be really bad. You can end up in the hospital. I know it sounds silly, but it can be really painful. So you have to be aware of those risks, and that's why I think it's important if you are thinking about this medication that you're being seen by a physician or a practitioner who knows what they're doing, knows how to administer the medication, knows some of the side effects to the medication, and that this isn't just get skinny quick.
Right. And everybody wants that. I mean, that's human nature. Everybody wants the easy fix to make me be exactly what I want. And unfortunately, I think what we've learned is that it's just not out there. It's going to be a journey, and if it's going to be sustainable, you got to make the right decisions over a period of time.
And being thin or being some number on the scale, that's the other thing that I talk to my patients about. Sometimes they'll come in and say what weight should I be? And it's going to vary from person to person, right? So skinny doesn't necessarily mean you're healthy. You might be at a lower weight, but that doesn't necessarily mean you're healthy. You can have other health issues and still be at a lower weight.
Yeah, and even your percentage of body fat versus whatever. Correct. I've seen several people on Instagram. Yeah, that they'll do side by sides, and they'll be this was when I weighed 116 pounds, and this now I weigh 130 something, and they look fitter and better in the one where they weigh 130, and obviously feel better,
right?
Because they're actually building muscle, they're eating nutritionally, so.
Yeah, that's probably a better indicator of health, right, is your body composition, more than that number on the scale. So we do use that, right, a BMI. If you've heard of BMI, which is kind of like a screener, right? We know that at super high BMIs you're going to have more association with heart disease and all of these other comorbidities. Really low BMI too, right? People who have problems with disordered eating, for example. That's also not healthy. But it's really a screener. It's not really going to tell you like how healthy you are, because you can have two people, because it doesn't take into account if you're male or female. It doesn't take into account your ethnicity. Some people just have, their bodies are just different. They may have more muscle. So if you have two people, same height and weight, may have total different, like in terms of their health, one might be way more healthy than the other. So we can't just go based off of that number on the scale. That's the other thing that I try to talk to my patients about. Like, we have to change our mindset. This isn't about just being thin.
Yeah. I definitely, when I'm working out, I like to track, like go to do one of those scans where you can enter in your weight and stuff, and it does tell you the difference. And that was one thing I did like try to focus on, was that I was just gaining muscle, losing fat, not necessarily losing body weight per se, but
that can be frustrating too, right? There's something in your brain that's like
so like
right, especially women are on your cycle. You're gonna you're gonna feel like you've gained 10 pounds. You didn't really gain 10 pounds.
I feel like you fluctuate like within 5 pounds at least, but day to day. I mean, if you weigh yourself every day, it's a different number every day.
No, you don't do it every day. I think I do it like every 3 months or something, just to make sure I'm not going off the rails unexpectedly. Because that can be real frustrating if you're like obsessing over over a weight number.
Right. So a lot of people feel like I should just go from this weight to this weight. And that's really not how things work. Like, you're going to have fluctuations. There's going to be times when you go up a little bit, times when you go down, and then times when you go back up, because life happens, right? There's going to be things that you might be more stressed, and you're going to be more, stress eating more, or there might be when you're like working more, so you can't make it to the gym like you usually do. So
life,
you have to take into account.
Life happens. The important thing is just not to stay in a bad place. If you get to a bad place, like, get help and see
Erica's
what you can do to make
herself right now.
I'm getting these ups and downs, but we got good doctors that can help us out. So,
well, I think we have to wrap up. I think we're close to our time now. I feel like we could just talk to you forever and ever.
I love to talk about this. So
it is so fascinating, and there's so much. It's out there everywhere, but it's hard to get like credible like insight into where it came from and how we're moving in that direction. So if anybody's interested in learning more, we of course will link information to Dr. Guadiana Sanchez's information below.
Yes.
So be sure to tune in. And then so we'll wrap it up. Are you going to ask your famous question? I don't think you eat here much because you're not hardly in the hospital.
Yeah, I normally ask what people's favorite meal is here, because a lot of
like at the cafeteria?
Yes, because a lot of our dogs are here, but you're in a clinic, so I just don't think that you eat here.
I don't. But I do. There is a cafeteria at Smith, and so sometimes I will get food there, and they make like the best quesadillas.
Okay.
Well, see, I don't even think we get those here, so I'm
Do you not? Oh, you guys have to come over.
Okay.
I think it's on Thursdays. They come.
All right.
I've never seen that here, but we might have to take a road trip.
So good.
Well, very cool.
All right, that's a new one. We haven't gotten that one. Shout out to the SGMC Health Smith Northview cafeteria.
All right. Well, everybody, be sure to leave us some comments. If you have questions about anything that you've heard about, you can send those to us as well. We can help get you in the right direction. But overall, I just thank you for tuning in.
Yes. Thank you, guys.